My name is Paige Barnish, and this is my case study presentation for Advanced Clinical Social Work Practice with Professor Reeder Braun. Looking at our client, so for the purpose of this assignment, we will refer to the client as Danielle. Client overview. Danielle is a 31-year-old Latina woman and single mother who recently began outpatient treatment at Compass Wellness. Danielle presented with persistent sadness, hopelessness, fatigue, difficulty sleeping, poor concentration, and little to no interest in activities that she once enjoyed. So we see that Danielle is identifying persistent depression symptoms here. And Danielle was describing these symptoms having a pretty significant impact on her parenting abilities, her work abilities, and her interpersonal relationships. Danielle described feeling as though she was running on empty every single day and was having worries of feeling like she's failing her children because of her recent low energy and lack of motivation. So Danielle's presenting concerns. Danielle described feeling sadness, hopelessness, and persistent fatigue. She also described sleep disturbance, having consistent sleep issues throughout the night, not getting a good night's sleep, and also having low motivation and feelings of guilt just around her parenting, feeling as though she was lacking or failing in some way when it came to her children. So, kind of taking a step back and looking at Danielle's psychosocial history. Danielle did grow up in an environment of emotional neglect where her needs for attention and support from her parents were consistently unmet. So she did experience that emotional neglect during childhood. Um, as Danielle aged and entered into adulthood, she then experienced a pattern of abusive relationships, mostly romantic relationships that contributed to Danielle having feelings of worthlessness and being mistrusting of others. So Danielle does struggle with low self-esteem and trust issues. This forces Danielle to question her value and her worth just based on those past experiences and her own sense of identity as an adult. So, current stressors, things that are affecting Danielle and her situation. So, Danielle is a single parent, parenting two young children. Danielle's two children are ages 2 and 3 months. So, being that Danielle is also currently caring for an infant that requires a lot more attention and care, that's a big contributing factor to Danielle's stress. She is also experiencing limited family support and consistent financial issues. So, the responsibilities of single parenthood combined with uh, financial concerns and some chronic health issues that Danielle experiences. Danielle does experience frequent migraines and hypertension. It does contribute to her lack of energy and exhaustion. So, all these factors kind of combined have a significant effect on Danielle and her mental health symptoms. So, taking a shift and not focusing on the problems, but focusing on the strengths and resilience going on in Danielle's life. So, despite her hardships, Danielle has remained sober for over 2 years since her first pregnancy, which is a consistent strength and a major turning point in her life. Danielle did describe having some previous issues with alcohol use, which contributed to some negative mental health. So Danielle being able to overcome uh, that challenge in her life and to obtain sobriety and remain sober is a significant strength. Also, Danielle's commitment to her children. So, despite the financial barriers, despite the bumps in the road that Danielle's experienced, she continues to provide the best care for her children, consistently providing all of their needs before her own. And Danielle is also voluntarily engaging in therapy. So Danielle made the decision to seek out therapy and is self-aware of her limitations right now, and the need for gaining support. Danielle also identified feeling that she had postpartum depression after having her second child, her 3-month-old. So that is contributing significantly to what is going on with Danielle. But the fact that she is identifying these concerns and seeking support right now shows a significant strength for Danielle's continued mental health journey. So, kind of shifting into part of the presentation was coming up with the framing question for Danielle in particular. So, the question that I came up with for this particular case study is how can a trauma informed person and environment framework help treat a young mother dealing with major depressive disorder caused by complex trauma and chronic stress? Um, so just thinking about this question, this recognizes that Danielle's depression is tied to her history of childhood neglect, the adult trauma that she's experienced in her romantic relationships, her financial struggles, and her own physical health issues. So, a person in environment view essentially recognizes how different systems like family, culture, socioeconomic conditions, and our overall health can all interact with our mental state. And particularly with Danielle, um, she did speak about struggling with constant anxiety about whether she could raise her children without repeating the same cycles of neglect that she experienced in her own childhood. And Danielle also shared repeated financial crises, not only in her adult lifetime, but in her parents' adult lifetime, when she was a child as well. So just considering all of these factors in Danielle's journey, recognizing that she has experienced trauma, and how can we maintain this framework and take a step back to realize what Danielle has experienced and properly support and treat what she's going through. So for diagnostic summary, for Danielle, Danielle does meet the criteria for major depressive disorder with a possible PTSD comorbidity. Um, so Danielle does have depressed mood most of the day, nearly every day. She has significantly reduced interest or pleasure in almost all activities. She's experiencing significant fatigue and loss of energy, insomnia and poor sleep quality, feelings of worthlessness and excessive guilt, difficulty concentrating and indecisiveness, and also psychosocial issues in work, parenting, and her relationships. So, given those symptoms of criteria that are met, with symptoms lasting more than 2 years, Danielle does meet the diagnostic criteria for major depressive disorder. Uh, Ruling out some other diagnoses, Danielle does not have any symptoms that would point to manic episodes. So that rules out bipolar disorder. Danielle does experience anxiety, but that symptom does seem linked to her trauma history rather than a primary anxiety disorder. And given Danielle's past with the emotional neglect and abuse that she experienced in childhood and early adulthood, PTSD is most likely a comorbid diagnosis for Danielle, especially because Danielle has mentioned emotional flashbacks, intrusive negative beliefs about herself, and avoidance behaviors when she discusses painful memories from her past. And those all align with criteria B through E of PTSD diagnosis, according to the DSM 5. So moving past diagnostic summary. So thinking future forward in terms of treatment for Danielle, I plan to use a blended trauma informed, strengths based, and person centered approach that utilizes cognitive behavioral therapy for Danielle's negative thinking patterns and dialectical behavior therapy for emotional regulation of Danielle's mental health symptoms. So, particularly with CBT does focus on identifying and challenging negative thought patterns. That would be, in Danielle's case, we would be looking at those negative thought patterns that worsen her feelings of guilt, hopelessness, or being a bad mom. So, early sessions with Danielle could focus on educating her about a connection between thoughts, emotions, and behaviors, kind of the core ideals of CBT, and also working on developing realistic thought patterns that just benefit her self-esteem moving forward. So, for example, when Danielle says things like, I'm failing my kids, I'm not a good mom, utilizing cognitive restructuring could help her focus on her strengths, like her sobriety and what she's achieved thus far as a mom, rather than focusing on her interpreted failures. Then with DBT, since Danielle often shares that she's feeling overwhelmed by her emotions, some DBT skills training could enhance her emotional regulation abilities and her distress tolerance. And some techniques like mindfulness and grounding could support Danielle in lessening her reactivity and kind of restructuring her mindset to stay present during moments of recalling trauma or feelings of parental guilt. Thinking even more forward, future treatment directions for Danielle. So, other things that Danielle could benefit from, in addition to the psychotherapy, is strengthening her coping skills, building on the coping skills that she'll be learning in therapy, whether that is with group work, perhaps, um, or independent utilization of coping skills, um, and 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 thinking of Danielle as a person, thinking of just from the person and environment lens and a lens of cultural sensitivity, because Danielle is a Latina woman. There is research that shows that how Latina mothers often face stigma around mental health treatment, and there are unique cultural expectations about motherhood and sacrifice and how the mother should place the needs of the child before her own. So I think keeping these cultural factors in mind can also be a part of the future treatment goals and treatment planning for Danielle. Um, and increasing her community supports. So, again, thinking of her culture and her background, um, just bringing more community supports into Danielle's life would be beneficial to not only her mental health, but just creating a sense of safety and trust within the community, with other moms in particular that she could feel connected to and share stories with. And finally, parenting focused interventions. Being a single parent is difficult, and Danielle has expressed time and time again that she feels like she could benefit from additional supports in the realm of parenting. So, connecting Danielle with maybe some parenting support groups, or parenting aid groups, that might support Danielle in her treatment journeys and just feeling more empowered as a parent. So in conclusion, kind of looking at Danielle's case study as a whole, the conclusion that I came up with from this case is that Danielle is a wonderful example of the complicated, intertwined connection that exists between individuals' trauma, their current mental health, and resilience and strengths. And despite those difficult, traumatic experiences, despite the struggles with mental health symptoms, the resilience and the strengths ultimately balance out, that individual being able to pick themselves up and uh, improve the status of their mental health, when there's internal motivation. So throughout this case, I've learned how crucial it is to look at depression symptoms, especially not as an isolated diagnosis, but as a result of unresolved trauma and environmental stress. And the therapeutic focus here for Danielle, I think, is empowerment and safety. Just bringing it back to establishing that safe space where Danielle can feel empowered and motivated to be her best self, to be the best parent that she can be, and feel confident in her ability to to be that person. So a goal for Danielle is to rebuild hope and stability. Ultimately, my goal would be to help Danielle rebuild that hope within herself and see herself as someone who is capable, who is strong, who has survived significant challenges in the past, and someone who's continuing to learn to rebuild her life, independently, and use those recognized strengths to move forward and to support Danielle in truly feeling empowered.